And it does speak to forward thinking and planning by the team here that recommends these things to the government, who then actions them. And so we had always announced the plans to advance more beds. Initially, it was about the national arena. Then we changed and we identified 2 locations, one at St. Joseph's Hospital, the other in Falmouth in Western Jamaica, Falmouth Hospital. Now, luckily, 5 months ago, we broke ground for those 2 facilities. I want to commend the ministry, the permanent secretary in this case, working with the regions and indeed the contractors who are deployed and the project management team, because within that 5-month period, they were able to build out 2 facilities. I visited St. Joseph's today, and that facility is a real first-class facility. I mean, I was very impressed, and all accounts, including MP Julian Robinson, the councillor, the mayor, of course, our team, because we now have that 36-bed facility that would add to the bed count for COVID patients, equipped with all the necessary infrastructure for oxygen, ventilators, all the other stuff. Tomorrow I'm going into Falmouth to look at the other facility, which I understand is almost complete. So in a sense, in the nick of time, we can say that we have added, or will add in a few days, some 72 beds, 2 locations, one in Kingston, the other in Western Jamaica, as we had anticipated would be like a likely possibility. And these are now going to be equipped with the necessary infrastructure to deal with any overflow. As the CMO said, or I said earlier, we're at 85.4% now. At this rate, we will become overwhelmed and we will need that additional capacity.